Hello, and welcome to another edition of Johnny Bill's Pharmacist World. For a long time, I've been an advocate for independent pharmacies and independent pharmacists. I've been a pharmacist for over 35 years now, and I started my career working for the chains. I've worked for, I started my career with a chain called Revco, and Revco became CVS, and I've worked for Walmart, and I've worked for People's Drug. I've worked for a lot of different places in the chains, and so I've got experience with their corporate mentality, their management's mentality, and then I was working for CVS, and in 2007, one of my best friends that owned several drugstores at the time, three of them, decided to build his fourth store and said, "John, come run this store and I'll leave you alone and let you open it and run it," and gave me complete autonomy. And I opened Rocky Mount Family Pharmacy in 2007 and left it 10 years later, and it was thriving. I learned what it was like to be an independent pharmacist. I became a pharmacist years ago because of an independent pharmacist. His name was Bill Turner, and Dr. Turner was owned Turner Pharmacy in Fairmont. He was a chemistry professor at Fairmont State College, where my mother was also a professor. He was the consultant pharmacist at Fairmont Emergency Hospital, and he was also the mayor of Fairmont, the town I grew up in. And I admire Dr. Turner a lot, and he's one of the reasons I was his prescription delivery boy when I was 16 years old. And I got to see what it was like in an old-fashioned mom and pop drugstore that had a soda fountain, and I delivered their prescriptions, and he was such a hero in my mind. And I trusted him. The whole town trusted him. And I admired him a great deal, and I became a pharmacist in a lot of ways because of how much I admired Dr. Turner. And so I've admired independent pharmacists and pharmacies all my life. And lately, independent pharmacies, in the last few years especially, in the last 5 years especially, have been getting choked to death and by the pharmacy benefit managers, the PBMs. The reimbursement that they're paying them for the medicines is not enough to survive on. And they've slowly and methodically, over a period of 5 to 10 years, really are threatening their survival. And with the COVID-19 crisis that we're just gone through, it has become evident that the 22,000 independent pharmacies in this country are needed for our society to survive. They're out there practicing pharmacy better, smarter, and they're vital to the survival of our society. So we've got to come to the table and make the PBMs quit choking independent pharmacy to death. We're going to need independent pharmacy. We're going to need independent pharmacists. We need the chains too, but the chains don't care about their people and about people in general as much as they care about a dollar. Sure, a profit is the most natural function of a business, but the change in the corporate mentality and the management philosophy is put that above all else. The independent pharmacies put their patients, their people, their staff, and their pharmacists above all else. And that's a big, big difference. There's compassion and there's true trust there by the public. A lot of the times you don't see that with the management corporate greed mentality calling the shots. That needs to change. We need to make pharmacists providers of medical service. We need provider status. We need the PBMs to quit choking us to death by recommending a reimbursement on all drugs reimbursed the same way. It's called parity. It means everybody gets charged the same price. And it needs to be transparent. We need to have transparency. Nothing done in secret, everything done up front. What's wrong with that? Okay? The answer is nothing's wrong with that. And that's the way it needs to be. Pharmacists are going to end up being what's called point of care testing, where we're going to test for COVID-19. We're going to test for influenza. We're going to test for strep. We're going to test for HIV. We're going to test for Hep C. We're going to test for diabetes, cholesterol, high blood pressure. The pharmacy is going to be vital to the healthcare team and to getting people funneled to the help that they need when they need it, quickly, efficiently, and done with compassion for the patient, where the primary responsibility and the primary idea and the primary goal is patient outcomes, not lining your pockets. I'm telling you, this is what this country's got to do, and it's got to happen soon. We've learned this from the virus. Point of care is going to emerge as the norm. We need to address the drug shortages is the next thing. The independent pharmacist and the chain pharmacist, how would you like to be the guy that has been filling these patients' prescriptions for chronic diseases for years, and now all of a sudden you have to tell a patient, gee, I'm sorry, I can't give you your medicine because the supply line was sold to the Chinese because of globalization 2 decades ago. It's time to get our supply lines out of China. I think we've learned that lesson. They're now holding us hostage with our own medicines. That's got to stop, period. And that's a no-brainer. So it's time to reverse the globalization of our pharmaceutical industry and the medicine supply line and bring it back home where we can rest assured that the supply lines will always remain open and we don't have to tell patients, look, I'm sorry, I can't get your medicine. It's on back order right now across the whole country. The management and the corporate philosophy aren't the guys that have to do that. It's the pharmacists that do. And you got to tell somebody that trusts you that you've got to let them down. That's not fun, folks, and we want to stop it. So we must have provider status on a national basis so that we're able to bill Medicare and Medicaid and the insurance plans for our vital services. People are going to seek these services anyway. We're going to give them to them anyway. We deserve to be fairly compensated. An independent pharmacy deserves to thrive for the good of the country, for the good of everyone. Come on, people. Get with the program. Change our world now. And thank you for listening to me on Johnny Bill's Pharmacist World. Bye-bye for now.